Okay, folks, this lesson is about the veins of the thoracic and abdominal region. Learning objectives: identify the anatomical structures of thoracic and abdominal veins. Identify the location of these veins. All right, I'll just kind of use this as an abbreviation, hopefully on some level or another. DOB just simply stands for deoxygenated blood. Deoxygenated blood. So if you see like DOB, for instance, like here, okay, that just means deoxygenated blood. Okay, so again, here in this picture, we're just showing just the vastness and variety of veins. And again, the veins are simply returning deoxygenated blood to the heart, to the right atrium. Then goes to the left atrium, then goes to the lungs and comes back to the heart. Okay, so let's just look at some of them specifically. And this is not marked, but the hepatic vein simply actually is draining blood from the liver to return back to the heart. Let's see here, the basilar vein. This is simply just a large superficial vein of the upper limb that helps drain parts from the hand and the forearm. So just talking about how basically blood from the hands and forearm and these areas are eventually going to go up into this area and then eventually, of course, go into the heart area. All right. Then you have the renal vein, simply returns DOB, deoxygenated blood, from the kidney. So when you talk about renal, that's automatically, that's a knee-jerk reaction to automatically think of kidney. So returns blood from the kidney to the inferior vena cava. Again, superior vena cava is above. All right, maybe this might kind of make it a little more visible. Above inferior vena cava from below. All right, inferior below. All right, to the inferior vena cava and then to the heart. All right, the gonadal vein simply returns the DOB from the sex organs to the inferior vena cava. Of course, then you get your lumbar veins. That's kind of like in the lumbar area. Again, simply returning the deoxygenated blood, all right, back to the heart. So again, like I said, all these iliac, external iliac, internal iliac, the deep femoral, all right, femoral veins. Again, they're all returning deoxygenated blood back to the heart. And if you remember when we talked about in terms of the arteries, you had the femoral arteries, you had the external iliac artery, the internal iliac artery. Well, conversely, we have it on the venial side as well. So the external iliac vein, internal iliac vein, all right, and the femoral artery and the femoral vein. So it's kind of like a lot of times where that we have a particular name for the artery. Conversely, in many cases, we have that term for the vein. Of course, you have the subclavian vein. Again, it's just a vein that goes underneath the clavicle, subclavian. But we also have the subclavian artery. So those are just some examples. All right. The brachycephalic vein returns oxygen depleted, and sometimes you'll see oxygen depleted or oxygen poor or deoxygenated blood. So oxygen depleted, oxygen poor, deoxygenated blood, they're all synonyms. They all mean the same. So again, simply just returning that blood from the upper limbs, neck and head to the heart through the continuation to the superior, again, the superior vena cava, and that drops down into the heart. All right, so the lumbar vein. All right, so that is that what you see actually like in pink. Okay, so it's just again just going along the lumbar region, and again the veins are going to be returning the blood is going superiorly. All right, so superior, above. Remember the anatomical structures and positionings that you learned. Inferior, below. So this is the anterior view. So again, the anterior view is basically where that it is actually anterior in front of the actual vertebral column. Okay, so external jugular vein simply collects blood from the external jugular vein. Collects blood from the vein in the superficial parts of the face and neck. Subclavian vein, again, like I said, below. Sub means below the clavicle. All right, I think I talked about this already. Simply returns oxygenated, depleted blood from the upper limbs, neck, and head to the heart. All right. Cephalic vein runs up the lateral side, and when we talk about lateral, we're simply just talking about the outer side, because when we talk about lateral, all right, is kind of going towards the outer portion, almost like in football. If someone gets a lateral, you're actually pitching the ball to a player who's on the lateral side of the quarterback. All right, so the lateral side of the arm, from the hand to the shoulder. It empties into the axillary vein right here. Axillary vein. After the cephalic vein. So you got this. So it's basically kind of like one long connection, really. It's just as the vessels actually, ascend and go superiorly or inferiorly, the name changes. Sometimes it's almost like with streets. You can be like on one street, and then all of a sudden, when you reach one maybe community or a municipality, sometimes that same road that you've been driving on for quite some time, it just changes names. All right, but in terms of anatomically speaking, sometimes it changes names based upon the reference point of maybe some of the other reference points in terms of what's going on or what has already been deemed and named in that particular area of the body. Okay. All right. Azalus vein runs up the thoracic vertebral column, draining itself towards the superior vena cava. All right. So as you see it here, comes up here, drains itself towards the superior vena cava. All right. It connects the systems of superior vena cava, and inferior vena cava. All right. Again, I think I talked about the renal. All right. Just simply taking deoxygenated blood from the kidney. All right. I think I talked about this right here. Just simply taking deoxygenated blood from the sex organs. And then again here, the internal and external iliac veins simply drains blood from the lower extremities towards the heart. Right here, kind of more so of a close-up of the kidneys here. The right suprarenal gland right here, right suprarenal veins right here. Okay, and again, as you're looking at it, it's like, wait a minute, this is on my left side, but we actually talk about it in terms of from the reference point, say if it's inside of your body. Okay, so if you kind of like move your body, you move your position. That's the same thing with the heart chambers. It's actually more so inside of your body. So again, I know this is kind of maybe a little cheesy looking here. Sorry. But again, same thing with the heart. Right here, this is for instance, the left what? Left what? Come on, come on. Left ventricle. Yes, you're right. Okay. This is the left atrium. And again, as you're looking at it, it's like, wait a minute, but that's on the right side. But again, it's from your reference point. But if you flip yourself and you're kind of referring to actually of it being in your body, just imagine it being in your body, it is on the left side. All right. And this is the right, okay, atrium and the right ventricle. So similar to like, as we see here. And the suprarenal vein, left suprarenal vein drains into the left renal vein. So this vein right here going to go into the left renal vein, and then that's going to take it into the inferior vena cava, and then that deoxygenated blood going to go superiorly up into the heart. And this is inferior phrenic vein. Again, it simply just drains the vein, or drains the diaphragm. So it's going to simply just drain the diaphragm. And what I mean by draining the diaphragm is simply just taking deoxygenated blood from the diaphragm and simply just going to return it back to the heart.